Patient experiences problems with his elbow when getting dressed. Upon assessment of osteokinetic movements, we find that the patient has limited elbow flexion. The therapist begins assessment of the elbow complex with the humero-ulnar joint. Assessment begins in supine with the patient's affected elbow just over the edge of the bench. The therapist palpates the dorsolateral joint line and applies traction in the maximally loose pack position, which is 70 degrees elbow flexion and 10 degrees supination. The traction direction is always dorsal and distal at a 70-degree angle from the plane of the ulna. To further provoke the restricted capsule, maximally loose pack position is left for the more limited direction. Traction is then reapplied. Treatment of the humero-ulnar joint must also be done in the same way with added intensity, as it is a joint unable to glide. The therapist goes on to assess the humero-radial joint. Assessment begins with the fixation of the humerus against the table and holding the distal radius against the therapist's body, with palpation of the dorsal joint line. Traction starts in the maximally loose pack position, which is again 70 degrees elbow flexion and 10 degrees supination, and is applied along the longitudinal axis of the radius, focusing on body mechanics of the therapist. For a higher actuality stretch, the joint is brought outside of its maximally loose pack position and towards the limited direction. Traction is then reapplied.